real enforced lockdown. And some states have been doing better than others, but as a whole, the situation still looks very grim. It's been very hard to engage the population. And even now, state governors who were doing quite a good job some time ago decided to reopen the economy. So we haven't even gotten out of the first wave. And we are already talking about a second wave, which actually doesn't exist. We have one wave only. It's like a tsunami, really. We never got out of the first one.
Wow. And how do you think then, given everything you've just told us, what is the attitude of the everyday Brazilian? What comes to mind is, who is bearing the brunt of this pandemic? Comes to mind the impact on Brazil's different populations, vulnerable populations, and even the impact on Brazil's indigenous communities.
Yeah, the country is very divided, Pablo. So when you say the average Brazilian here is we are in such a polarized political situation that the average Brazilian actually divides into two main groups. The group that agrees with the government that it's just a minor flu. So they go out on the streets and shake hands and take selfies and hug other people and pretend that's nothing happening. And this is a considerable part of the population because they get the role model from the president himself. Mm-hmm. And then you have the other group who are people who are trying to collaborate and to stay home and practice social distancing and physical distancing and all the preventive measures. And of course, you have all the vulnerable populations. So indigenous populations, they are very vulnerable. They live in places where there's no healthcare system available and places that are difficult to reach. Some places you can only reach by boat or airplane. And so when these people get sick, it's very difficult to treat them or to remove them from their homes. And of course, communication isn't always that easy. So there are some indigenous tribes that don't even speak Portuguese. They have their own language. And we have to translate every recommendation of social distancing and preventive measures into their language and try to talk to their leaders and explain how the pandemic works. So it's been quite a challenge, and it's been done by independent NGOs because the governments aren't really engaged with that kind of work. It's been hard here.
I'd like to come back to that a little bit later, but focusing on the first thing you mentioned, that how the population kind of divided into two camps. We see that problem in science communication in different areas, but if we get back to the facts, let's say the Washington Post published an analysis this past Sunday about how Brazil is now facing the coronavirus disaster scenario that almost everyone saw coming, except perhaps President Bolsonaro. He's been very skeptical about the virus, and we've seen that in different types of media. So I guess we thought it'd be pertinent if you could tell us a little bit about how his skepticism differs from the skepticism that your institute promotes.
Oh, it's totally different things. And the skeptic community usually prefers to differentiate that between skepticism and denialism. So skepticism is a healthy doubt. Is when you doubt things because you want evidence. You want everything to be evidence-based and you want to see the facts. And denialism is just the opposite of that, is that when you're presented with evidence, you're presented with the facts, and even in the face of evidence, you deny it. You see the evidence and you deny it. So it's the complete opposite of skepticism. But in the end, we use skepticism for the skeptic movement internationally. It's been there forever, and we see no reason to change it. So we try to change the other one. We try to tell them, no, what you're doing is denialism. So
that's great. Thank you for that description. following this thought process of what are the consequences of maybe not paying attention, can you tell us a little bit about Bolsonaro's role in creating this crisis that we're living? Did Brazilians' health officials see it coming and sound the alarm, or has the denial, which you mentioned, been pervasive throughout his whole administration?
I think yes to both questions. Health agents saw it coming, but there was not much they could do about it. You know that Bolsonaro has already fired 2 health ministers, and at the moment we have none. So we have been out of a minister for a month already. During a pandemic, during the worst health crisis we ever faced, we have no health minister. And he fired the previous 2 because they didn't agree with him or about social distancing and about miracle medications that Bolsonaro promotes. So he's always been a science denialist. All throughout his government, he's a climate change denialist, and he never cared for science and education. So we had our science budget cut in half during his government. Not that it was much better before, let's make that clear. Science was never a priority here in Brazil, but it's never been this bad. And Bolsonaro, he cut, so he has a total disregard for science and education. The Minister of Education, who is a close friend to the president, and they see eye to eye, unfortunately. So the Minister of Education has been accusing the universities of just promoting naked parties for students who produce nothing for the society.
Oh.
So that's how they see us. They see us like a bunch of crazy students who go around naked and smoke weed and do nothing for the society. They don't understand that the universities are research centers, right, and that we give back to the society in knowledge and technology, and there wouldn't be a modern society without the universities and research institutes. So that's not, of course, not only in Brazil, but throughout the world. Well, so it's a very anti-science government from the beginning.
Well, regardless of those anti-science sentiments that you're telling us about, now that the virus is seemingly undeniable, even to Bolsonaro, how is Brazil responding to this high death toll and growing number of infections? Because it feels like that is a stark reality that, regardless of what was said before, now countries must face. So is there testing? Is there contact tracing? Are hospitals well equipped? It comes to mind, why is this death toll so high? And I guess, can you talk a little bit about that?
Yeah, so there is no testing, no contact tracing. Some hospitals are well equipped. Brazil is a huge country, so it depends very much on the region, on the city, on the state. Mm-hmm. So we have very rich states like São Paulo, where the hospitals are well equipped, especially the private hospitals, but even the public ones are very good. And then we have very small towns in the middle of the Amazon state where, of course, you have no hospitals at all. So it depends very much on the region. And about testing and contact tracing, we do very few of those because the federal government hasn't invested in importing reagents to build the tests here, or even to import the tests equipment themselves. We have very few universities and research facilities that would be able to perform those tests safely with adequate personnel. So we don't have the capacity really to mass test the population. So, and also we haven't been investing in that properly as we should. So we test very, very little. It's a shame. Even in São Paulo, which is the state with the greater number of universities and research centers, we test very little. We should be testing much more, and we do almost no contact tracing. So it's been hard. But the first part of your question, you said there's no way that even Bolsonaro can deny it now because of so many deaths and the number of cases rising. But still, yes, he denies it, and that's what denial is about. It's like I said, you deny science, you deny the evidence that's standing just in your face. And Bolsonaro, for instance, last week, he actually asked the population on national television. He said that people should break into the hospitals to check if this is true, if people are really sick, if people are really hospitalized because of COVID-19, because he didn't believe it to be true. And guess what happened next? People broke into hospitals. So it's unbelievable. He says something like that and people listen to him, and that's the danger of it.
Which brings to mind other dubious claims. For example, I know Bolsonaro, like President Trump, has promoted some would think far-fetched comes to mind possible cures for COVID-19. With both of them particularly enamored by hydroxychloroquine and chloroquine. And so when you're telling me about this, what immediately also comes to mind is, how has this stance harmed the country's response? Because if they're doing what their leaders instigate them to do, and then we hear these claims for a possible solution, how does this affect the population, or how has this affected the population in Brazil?
Yeah, that's the problem when you promote miracle cures. People believe you. And people believe Bolsonaro when he says that hydroxychloroquine works. Now he changed his mind a little bit and he went for a dewormer called ivermectin. I don't know if you've heard about it, but that's also becoming a thing here in Brazil. So now we have two. We have hydroxychloroquine, which is now a standard protocol for the national health system, even for pregnant women and children. That's really unbelievable. At the same day when the FDA lifted the emergency use for hydroxychloroquine in the US, here we passed it as a national protocol for children and pregnant women, because before they weren't allowed in the protocol. So now it's there for everyone, regardless of age, and everyone can use it. And now we have another drug that's called ivermectin. It's a dewormer and a flea medication. So when the president himself endorses a miracle cure and he says it's just a minor flu, I don't even believe that it's true. Social isolation is not necessary, and look, here's the cure. How do people react to that? They go out on the streets as if nothing was happening, because that's the message. The message is that we are exaggerating, and even if it is true, we have the cure. So why should I bother? Why should I stay at home? Why should I not be working? And that's what happens in Brazil.
Well, Natalia, having followed your work and appreciated a lot of the things that you've done recently, I immediately go to this example of what happens when these claims that are not science-based find their way into policy. And I know that one of the major focuses for your institute is fighting against homeopathy, and how that plays into the broader government stance and implementation of policy, of government policies. Can you tell us why you're concerned about that in particularly, and how this kind of like mirrors that reality in Brazil?
Sure. The first thing I have to say, I miss fighting homeopathy. It was much easier than what I'm doing right now, and at least it's potentially harmless individually. People who take homeopathy are in no danger whatsoever as an individual. So I really miss that. But we decided to fight not only homeopathy, but alternative medicine in general, because alternative medicine here in Brazil is offered at the healthcare system. We have a national healthcare system which I think we are the largest country in the world to cater for the whole population with a national healthcare system. So we're very proud of it. We cater to 200 million people. And of course, it's not perfect, but it works. And we offer in this national healthcare system, we offer 29 modalities of alternative medicine that have no evidence of working, and still they are offered, they are paid for with taxpayers' money. So my institute promotes science-based public policies, and this is not science-based. So this is why we have been conducting this effort to fight pseudoscience in the healthcare system. And homeopathy and acupuncture are the only ones which are actually endorsed by the Federal Board of Medicine. So they are considered practical medical modalities here in Brazil. They are taught in medical schools and veterinary schools, in our best universities, even in the University of São Paulo, which is the largest university in Latin America. So this is our main concern. We started with homeopathy because it's very popular in Brazil, and it's endorsed by the Federal Board of Medicine. It's taught in our medical schools, and it's offered in the healthcare system. So it seemed to us that it was a good way to start, to show that this kind of medicine doesn't work. It has no scientific background. There are lots of countries in the world that have already stopped using it and have removed it from their healthcare system. So Australia has done it, the UK has done it, France is doing it, Spain is doing it. And in the US, I know that you don't have a national healthcare system, a public one, but I know that you have a consumer rights law that demands that every homeopathic remedy brings in the prescription, this is not science-based, or some kind of warning like that. And so you are at least informing people that this medication is not science-based as the other ones that are approved by the FDA. And in Brazil, it's considered real medicine. So that's our main concern. When you consider something to be real medicine, it's very difficult to explain to the population that it's actually not.
Which is, I think, the focus of this for professionals who work in science communication. That the worry that a lot of us have is how policies are made and how decisions at the highest levels are taken without a firm pro-science position. And so with this growing anti-science sentiment in Brazil, which I'm getting from our conversation, do you think that is this situation pushing people or convincing others to adopt Bolsonaro's positions on anti-science? Is the opposite happen? Will this stark reality of COVID-19 help to turn things around? Or do you think people are embracing the unproven treatments and just running with anti-science approaches?
I can't tell right now, Pablo. I think that, as I said, the country is really divided. So in a way, I see that people they are turning to science for answers. And maybe we can use the situation to really build up trust in science. Mm-hmm. And I hope we can do it. So I've been trying to. In a way, we have never seen so many scientists on national media, on TV, and on every newspaper. Even of course, I always worked with science communication, but I've never been on such a high demand here in Brazil. So I've been giving interviews all day long about scientific issues on the pandemic. And so science is being at least taken into account by the general media, and I think this is really good because it shows people that science is important. It shows the work that scientists are doing. It even shows who the scientists are, because people are not used to seeing scientists on TV.
Right.
And so I think this is the good part. But on the other hand, you have the government itself promoting anti-science. So I think only time will tell. Let's see if we can make this opportunity an opportunity to show how science is important, and that science works, and that it is science that's going to lead us through this pandemic and out of it. But I remain a little bit skeptic about it, really.
Yes, everything resonates with you. Of course, you know that everything resonates with us at the Alliance. We know that when it comes to science and health, people cling pretty tightly to their beliefs, even when there's a lot of evidence around this. There's been a lot of studies, as you know, regarding this. This can be true from climate change to GMOs to vaccines. So, and we've certainly been doing some work in this area, but I want to ask you, how is your institute working to promote rational thinking in these times?
So what we do, Pablo, and I think it's very close to what you do, but of course you've been doing it longer, and that's why I want to learn from you. But what we've been trying to do with the Question of Science Institute here in Brazil is to work with information being available to the public in a way that they can understand it. So it's a question of translating science into a popular language, in a language that anyone, even without a scientific background, can follow and can understand. So we've been doing this with the magazine. So we have an online magazine. It's called Question of Science, and it's free. It doesn't have any kind of paywall. We made a point of having a free online magazine so that really anyone can read it. And it's edited by a very experienced professional scientific journalist. So he makes sure that the language is appropriate, and that people and that it's readable for anyone. And of course, we have seminars and interviews and all the work that we try to build with the regular media, with the national media as well. So this is what we do to get information available to the general public. And then, of course, we try to reach out to members of parliament and of the government to help them use science when they are working on regulations and laws, and trying to make sure that these are science-based and not ideology-based. And I think this is the hardest part of our work. It's much easier, of course, to make science available to the public than to convince members of parliament that they have to trust science too. But with the pandemic, I think this is the good news. With the pandemic, several members of parliament reached out to us, because they wanted to understand the pandemic. And then it was a good opportunity for us to show what the Institute does and how we can help them. Of course, we can help them now with the pandemic, but we can help them with other issues after we get through this. So I think this was the good part, that all of a sudden these members of parliament and some members of the government reached out to us and said, well, okay, we want your help. We have to understand what's happening.
Right, and I think we have a question from the audience.
Yeah, sure.
We do, and it fits right into what you were just talking about, Natalia. So Jason's wondering, what do Brazilian skeptics see as their role in improving the COVID-19 situation? Are they protesting government mismanagement and science denial? Are they doing science-based public safety outreach? What kind of projects are being organized?
Yeah, that's the hard part of it, because it's been very lonely here in Brazil. We are the only institute in Brazil promoting skepticism, and the skeptic Brazilian community is still very small. We've been trying to build it, but the institute is really young. We are only 1 year old, and we've been trying to build the skeptic community in Brazil. So we have a very small community, and although they are really engaged, most of the work is being done by us, by the Institute itself. So we stick to the magazine, and we've been taking part in interviews and lives like this and several seminars. So we've been trying really hard to get information out there. And the other thing that we did was we filed a lawsuit against the government in the Supreme Court to try to remove the protocol for that authorizes hydroxychloroquine as a national guideline. We're still waiting for that to develop, but and unfortunately we did that on our own. We called every scientific society in Brazil to join us in this lawsuit, but they didn't want to. They were afraid of the government, they were afraid of retaliation. And so I think the most difficult thing here in Brazil is to build this community that it's really engaged and that feels that we can go into action. It's not only about talking, it's not only about outreach or science communication. There's more to it. We can act, but to act, we need to be together. And it was very frustrating, although of course I understand the motives of the scientific societies. I understand that there's reason to be afraid. The government has been really retaliating people who disagree. I mean, he fired 2 health ministers. So although I understand them, I really wish we could build this together. And I'm going to keep on trying. I think I can give them time, and maybe in the future we can help them organize themselves so that we can build a bigger community.
Well, it's a tough issue and it's a tough issue space to work in. I think this is a good segue into, I also wanted to ask you to tell us a little bit about that price that you have to pay sometimes for taking on these issues and for trying to get out there and do the work. What motivates you to keep doing this work? Because it's hard, it's time consuming, and I know a lot of people that I've met in this field have a real passion for it. And you strike me as one. I want to ask you, what motivates you to keep doing this work?
Just before I answer that, I just remembered I said every scientific society. That's not true. My own society backed me up. Microbiology Society here in Brazil, and a genomic society too. So I have to keep that in record. They were very brave. They backed me up in the lawsuit. And about your other question, Pablo, yes, I'm very passionate about what I do. So that's what keeps me going. I really believe in promoting skepticism and rational thinking. I really believe that if we really push hard, maybe the next generations will be made up by children who can think and who don't take anything lightly, anything that they see on television or on social media. They are not going to be as gullible as the present generation. And so I think this can be done. And I know that it's difficult, and I know that it's very lonely work, as I said, because it's not, sometimes it's just not even that people don't want to join or they don't believe in the work, but it's hard work. Mm-hmm. And it's very frustrating, and you know that because you've been doing it too, and it is frustrating. But there was no one in Brazil doing this kind of work before the Institute Questão de Ciência, before we decided to take it upon us to do it. And I've seen other countries do it. So I know that it can be done. For instance, when I said that Australia removed homeopathy from their national healthcare system and the UK did the same, I know that it can be done. It's just a matter of time and how much work you put into that. And I really believe that if we can accomplish that, we'll have people who can think by themselves. Maybe in some time our work will not even be needed anymore. Yeah. I hope.
Yeah, I agree completely. I think we've all seen how this pandemic has brought death, suffering, a lot of economic hardships. But we have, on the flip side, we've seen how some even civil society organizations have stepped up to fill that void that sometimes the governments are undercapacitated to fill. So I guess we're almost nearing the end before we open up to possible questions for the audiences. But you've mentioned that there may be a silver lining here that emerging from this, from the scientific community, from the world. I guess, as you know, the Alliance for Science, we like to take every opportunity to allow our audiences to hear calls to action. So what would you think, is there anything you want to put out there to the scientific community, to people who are interested in doing this work, who are interested in stepping up, taking part in the work that you're doing?
Yeah, I think it's very important for people to realize that they can help by engaging with us in this fight. We need engagement from the population. We really need help. And help means help us share the material that we produce, help us share the articles from the magazine, help us on social media, or if you see anything that strikes you as fake or as dangerous, you can bring it to us. You can denounce it and say, well, here, Question of Science Institute, I saw this. Is this true? So help us get the information and help us spread good scientific information. Many times we see people that say, oh, you're doing such a great job. And I say, thank you. Are you sharing our material? Because it's just not about complimenting me. I'm very glad for the compliment, but I need people to help. I need people to engage. And sometimes I think that we are very passive. We see good things happening around us and we don't help them. We don't broadcast. We don't share what they're doing. And I think it's probably the same with your work. So there's lots of people who really admire what we're doing, but they don't realize how important they could be as multipliers of the message. So we need people to multiply the message, to pass the message on. And this means small things like sharing information in your family group, in WhatsApp group, or on any social media, or speaking about it on your family reunions and gatherings and your friends' gatherings. Sometimes we just don't want to be that person, you know? We don't want to be, that person who always talks about what's wrong and on what's right. And when people start talking about astrology, there's always that one that says, well, you know, that's not actually true. So what I ask of people is, please be that person, because we need you. We need you. It's very lonely to be that person alone. And we need you to be the one who actually brings scientific information to your friends, to your family. Yes, it can be annoying. And yes, maybe your family will kick you out of Sunday brunches, but anyway, they're not happening. So this is a good time to start.
Yes. No, it's all right. I will. All right. I'll sacrifice my Sunday brunches. You convinced me, and I think a lot of the people who are looking at us or watching us agree. I think there's one more question from the audience, if I'm not mistaken, Joan.
Yes, there is. So the question is, how can the global South and the global North learn from each other to upscale the uptake of science outputs, especially in agriculture?
Woo! Wow, I think in agriculture, maybe Pablo is the best person to answer, really. But I can talk about Brazil, of course. We are a very agricultural country. So agriculture in Brazil has always been science-based, and that's a good thing. But the past couple of years, we have been invaded by a movement called agroecology, which is very anti-science, anti-GMOs, anti-biotechnology, or anything that's modern and that really helps agriculture. And we have a growing anti-GMO feeling here in Brazil. So I don't know if it's a North and South issue, because I think it's a worldwide thing. I think Pablo can help me here, but this feeling also exists in the US and Europe. And I think Brazil is a reflection really of what happens in the US and Europe. So all US and European regulations, they have an effect here in Brazil. And when Europe decides that they are not going to allow GMOs or genome editing or anything like that, it resonates here very strongly, even in a very agricultural based economy. So I think these things are very intertwined. What do you say, Pablo?
I would agree. I think agricultural policies are so intertwined with trade, with local communities, the work local communities do, the local trade. It's very intertwined. So I think anti-science sentiments are pervasive, as we talked about before. I think if we don't stay vigilant and if we don't take actions in those spaces where decisions are made and we're not talking out, a lot of the work the Alliance does, I think, is trying to get scientists to these events, these spaces where people make decisions. So I would say that anti-science sentiment is worldwide, and it can seep into the different decision-making spaces that may be critical. So it's important for us to work together, to work across the global South, and even from South-South cooperation to North-South cooperation. There's a lot of things that the global South can offer. I am always in awe of seeing what the scientists from the global South are developing, how they are passionate to develop local solutions to local problems. But as you mentioned, Natalia, I think sometimes they're influenced by these other bigger countries that have a lot of power in different settings, and sometimes they drown out the voices that from the global South that are really out there trying to change the conversation, trying to put forth new technology that will revolutionize their industry, their agricultural sectors. So I agree with you, and I think we all have to stay very vigilant to see how we can help make science the basic position for all governments.
You know what I was wondering, Pablo, if maybe after the pandemic, the feeling towards GMO and genome editing will change, because we see a lot of biotechnology being done, especially in vaccines. So we are engineering very modern RNA and DNA vaccines, and even if you take the Oxford vaccine with adenovirus, so it's a GMO, and do you think that this might change people's reactions to GMOs and genome editing or in agriculture, or it's something that people keep on separate boxes and never really realize that it's the same thing?
As before this conversation with the pandemic started, I feel that people do keep it in separate boxes. I think maybe Joan can speak a little bit about this, but some of the things we've seen is how the conversations about gene editing are turning a little bit more positive, because they're initiated from the space of health. And so because we're talking about these vaccines, and we're talking about the tomato that is being grown to try and get a COVID-19 vaccine, all of these science advances that our scientists are in the forefront trying to find a cure for this. I think there is a space, and I think we've been seeing how the conversations on gene editing are turning a corner. At least that is a hope for the Alliance. And we're definitely, one of the things that we're trying to do is talk about these things in new spaces, in trying to highlight how science can help us out of this difficult time.
Yeah, I think we should take advantage of the opportunity, really.
Yeah.
And that leads me to wonder, Natalia, do you see anything besides maybe a better attitude toward GMOs or something? Do you see anything positive coming out of this whole COVID-19 pandemic situation, or just sort of, you know, in response to people seeing what has happened in Brazil when the president has taken a very non-science approach. So I'm just wondering if you're seeing any silver lining here in this cloud.
I think so. I think when this is over and when people realize that it was science that got us out of it, and they're going to see several scientific accomplishments soon. So, for instance, now we have the paper about the corticoid has just come out as a possible medication. That's science. That's science showing results. Soon we'll have a vaccine, so we'll have more results to show people. And we say this is how science works. And science solves problems in humanity, has been done for forever. So when we have results, actual results to show to the population, I think that we can use that as a real opportunity, as a real conversation started to draw people to science and to show them how important it is to invest in science, to speak up for science, to defend science. And in Brazil, what I'm trying to build with the Institute now is to create something that you have in the US, but that has never been a possibility in Brazil, and that's science philanthropy. We have never been on the radar of philanthropy here in Brazil. Brazilian philanthropists, they support art, music, cultural issues, sports, but never science. Science in Brazil has always been public funded. And now the pandemic has opened a door to include science in philanthropy. So we're trying to build a culture here because, for instance, we don't even have tax incentives for people who want to donate for science. If you donate for sports or for any cultural aspect, you're going to get tax exemption. And I think it's the same in the US, but not for science. We don't get tax exemptions here to donate for science or for universities or for research centers. And with the pandemic, this changed. It's the first time that the University of São Paulo has opened an online platform to receive donations. We don't have an endowment policy. In the University of São Paulo, we never had. It's the first time this is happening. So this is something that I'm particularly very happy. And I'm going to try to build a philanthropic culture here in Brazil to try to get philanthropists to see science as an opportunity and as a necessity.
Well, before I get my wallet, I wanted
well,
to
thank you. We accept it.
Apart from this philanthropy aspect that I find very interesting, and what about all the other people who want to participate in different settings? You know, like you mentioned, a lot of everyone can help and everyone can put their 2 cents in. So how would we be able to contact, for example, if we wanted to engage in a dialogue, if we wanted to talk about this, if we needed stats or data, how would we contact your institute? Is there just so I know personally, I have a lot of friends. I know an amazing scientist in Brazil that would love to participate in this. So how could they get in contact with your institute?
So we have a website. If you look in Portuguese for IQC, it's Instituto Questão de Ciência, but in Portuguese it's Ciência, so it begins with a C. It's very easy to find. So we have the institute website, and we have the magazine website, which is a little more difficult for an English speaking person, but maybe if John can write it down with the comments, or because then it's Revista Questão de Ciência, which I know it's very difficult to grasp, but you can try some variations of it. You can Google it until you find it. You will find it, I assure you. And then you have all our contacts there. So then you have institutional emails and phone numbers that you can reach us. You can find me on Twitter too. Mm-hmm. If you look on Twitter for Natalia Pasternak Tashner, that's my last name. But if you use only Natalia Pasternak, you will find me. You'll find me on Facebook, Instagram, and all kinds of social media. So, and then you can find the institute through me. maybe that's easier. But and feel free to reach out to us. We welcome anyone who's willing to participate and help, and even write articles for the magazine. We're very open to that.
Great.
We really need collaboration, so feel free to reach out to us with questions and suggestions. We're always open.
Well, at least from my part, thank you so much for taking the time, Natalia. It's always great for us to talk to other people who are involved in this space, and I just thank you for the work you're doing, and I think that's it for me, John.
We do have one more question, which actually, when she said, feel free to reach out with your question, somebody did. Okay. So this is from Lydia on Facebook, and she says, I'm an educator with a background in research with GEs. I have taught seminars on genetic engineering and biotechnology, animal science, and in my current position, I teach microbiology. I was recently asked to teach an agroecology course. Do you think an agroecology course could also cover biotech, or does that entirely go against the premises of agroecology?
Yeah, it depends very much on the country, really. When I started the research in agroecology, I see that it has different meanings in the US, in Europe, and in Brazil. So in Brazil, agroecology is very anti-biotechnology, GMOs, any kind of biotechnology. They hate it. But I see that in the US it's different, and maybe Pablo can talk a little about that, because I don't know exactly what agroecology in the US is about. In Europe, it's a mess. It depends very much on the country. So I don't think it's a term that's really settled, and it's not a regular definition throughout the world. So I think that's what makes it weird, really.
Well, I mean,
the questioner is in the U.S. if that helps.
Sorry?
The questioner is in the U.S. if that helps.
Well, I would follow. I think it's very tied to what Natalia said. I think the problem with agroecology is that we don't have a clear definition. I think a lot of people are looking at. All right. Hello?
Okay, we can hear you now, Pablo.
Great.
I lost your sound for a sec.
I think agroecology is being viewed by different people as a movement, and it doesn't have a clear definition. And I think that you're right, Natalia. A lot of people, sometimes it seems that the term agroecology is used for different things, and there's not a concrete definition of what it is and what it includes. One of our fellows wrote a wonderful piece, Nassim Mugwanye, on what agroecology means in Africa, and how different organizations are looking at it in a way that may not be very effective in bringing solutions to a lot of their problems. So I think my initial recommendation would be to find out what this organization is trying to do. What are they trying to, what are their objectives? And I would never step back from a possibility of a dialogue. So I would say that it's about doing the research and trying to talk. I mean, I would always prefer talking than not talking, depending on what the position of this institution is. So I think it really depends on a case-by-case basis, but we really need to reach across the aisle so we don't talk in silos.
Yeah, I agree. And I have actually given talks to very hostile audiences about GMOs and GE, and sometimes it's really well received, because sometimes people don't really know what genetic engineering is about, and when you explain, they are very surprised. Mm-hmm. So sometimes just see it as an opportunity to bring information to people who really haven't seen it. They think that they know what genetic engineering is about, but usually they don't. And I think it's always an opportunity to show exactly how it works, and that natural is a very misleading concept.
Yeah. Talk about.
I think it's all about communicating and keeping the lines of communication open. And your conversation today has really helped us to understand much better what's happening in Brazil and what you're working on. Next Tuesday, we'll have Greg Jaffe. We'll be talking about how GMO regulations have changed in the United States. That'll be at 11 o'clock Eastern time. Then next Thursday, we'll have Mark Linus and one of our fellows, Modesta, talking about what's happening with the latest vaccines for COVID, the top 5 in the running for the COVID vaccine. So you can keep track of all of our events by visiting allianceforscience.cornell.edu. So I just want to thank you both for being part of this conversation, Pablo and Natalia. It was wonderful to hear you conversing.
Thank you, John, for having me, and Pablo, of course. It's always a good opportunity to show to the rest of the world what's happening down here in Brazil, even when the situation is as grim as it is. So thanks for listening, anyone.
Thank you.
Thank you, everybody. Okay, till next time. Bye-bye.